Hello, everyone. Taylor Dawson here with the Beacon Center, and I am joined by a very special guest today. Rob Tomsett is a lieutenant colonel in the Tennessee State Guard. He was active in the military for 24 years in the Army before he retired in 2006. And in 2011, he started one of Tennessee's very first direct primary care clinics. And so, at a time when healthcare is really in the spotlight, who better to talk to us than Mr. Tomsett? So, thank you so much for being with me today.
You're very welcome.
So, I see you are in your uniform still. Let's talk about your background and your story, and how has your life and your work experience led you to where you are now, both with your medical experience in the military and in your direct primary care clinic?
Well, I guess it started with the philosophy I had and what I learned in the military as a young medic. When I was a young medic with a platoon of guys, or when I was a team medic, and when I was a physician assistant in the military, it was all about taking care of those guys in the military and girls in the military that you were taking care of completely, totally, and not having to worry so much about a lot of red tape and nonsense. It was focused on taking care of them, and that's all it was. And so direct pay primary care is the same thing. You've removed that layer of nonsense with the insurance companies, and it's you and your patient.
Well, you answered my next question, which is the direct primary care model is a very freedom-oriented, free market model. I watched some of your promo videos where you talked about how you don't want to have a barrier in between you and the patients. And so I guess based on what you just said, your military background led you to believe in that freedom model for healthcare.
Correct. Yeah, absolutely correct. And that the direct primary care gets back to doing what I feel God has called me to do, and I guess what you say, floats your boat kind of speak, is that it's what I think is my life's calling, is taking care of my fellow human beings.
Right.
And that's what it allows me to do without that barrier of insurance in between. We just work together, the patient and I, for their best, and without the interference. And it's a great thing. My job satisfaction has gone up so much with direct primary care.
And I'm sure patient outcomes with it, it gives people a choice about where they want to go and how they want to receive health care. So I was told that you have been practicing a lot of telemedicine since you re-entered the military. Talk to me about that and how, your work in telemedicine has even maybe shifted your view of the healthcare system, or made you even more eager to pursue these freedom-oriented models.
Yeah, it's definitely a different time. I mean, I'm talking to you on my phone in my truck because I have a formation just a little bit over there in a few minutes because this activation for the State Guard. But in that time, too, we're doing definitely a lot more virtual medicine. Obviously, this is an odd time in America. I'm old enough to have seen a lot, but I've never seen anything like this. Even my mother has never seen anything like this. So I actually think that telemedicine's been around for several years now, and it's gradually been increasing, but this is going to be a real catalyst to change a lot in medicine. And I think telemedicine is going to be booming and a huge part of it. I think we're going to discover that we can do a lot of things with telemedicine, and it'll be a bigger part of it. And of course, obviously with direct pay primary care, it's okay. Telemedicine, here's your charge is $49, and you can talk to the provider and they'll take care of you. So it falls right in line with direct pay.
Right. Well, so, that brings me to kind of how I want to tie a neat little bow on top of this is a lot of people who are for Medicaid expansion say that it is the only way to make sure that people are taken care of. But you found many different ways. I mean, you're practicing telemedicine, you're practicing direct primary care in contradiction to those people who say that expanding Medicaid is the only way. What do you think would be a better way to completely reshape and reform the way that we deliver healthcare?
Well, I've said it for years. I think the best thing for healthcare in America would be for the government to get out of healthcare. It's not something they need to be in. It's not in the Constitution. It's not one of those rights. It's not. And when the government get involved, they become the driver, and then the other civilian or private insurances fall in line, and it's all based off of this. And it's again layers of bureaucracy that get in the way, and part of the lack of transparency and pricing and all these other things all stems from that beginnings of the expansion of Medicaid and Medicare in 73 and to this point. And the biggest thing that patients have an issue with, I think, and why they come to direct pay primary care so much is because they can't go anywhere and know what it's going to cost. Nobody can tell them. I hear it every single day that they tried to find out what this test would cost or how much this visit would be or what this surgery would be, and nobody could tell them. So it's a barrier to care. And frankly, I love this country. Obviously, I'm serving again now to help and do these things, but 24 years in the military taught me one thing, in looking at even this situation, the government situation. Often when the government gets involved, things don't go too well because you have so many layers of bureaucracy involved. And in healthcare today, the levels of administrative bureaucracy just to get patients taken care of adds to the costs and the frustration and everything of healthcare. And I've removed that. I just got that out of the way, and it's not in the exam room with my patients. It's 100% focused on them. They know that they get to make decisions, and they know what it costs before they walk away for everything I can do in my clinic anyway. And we don't have that barrier of somebody going, oh, no, your plan doesn't cover that. You can't have that. No, here's what it is. Yes, I think this is appropriate for you, and we'll see. This is how much it costs if I can give them that. Not everything outside of my clinic can I control, obviously.
Right.
But a lot of things I could tell them what it's likely to cost.
But you're giving people a choice and an option and something to turn to outside of the traditional model that we're all used to and we're all having to work in. And I think that that's amazing and remarkable. And we thank you for your military service and your service as a PA from the front lines of this battle against the pandemic. Any final thoughts for the viewers?
No, I just, I'd say give it a try if you haven't tried direct pay primary care. I even do have Medicare and Medicaid patients who come to me and use their Medicare, Medicaid as the backstop, their catastrophic kind of care. And the reason is because they have such a bad experience with providers who accept Medicare, Medicaid, and others, and how long their wait times are in the waiting room, and the frustrations with getting things done and getting answers. And when they go see a provider, they literally get 5 minutes with them, and then, okay, we'll talk about that next. Here's your medicines, and off they go, because they're under such pressure to see so many people. So I would say, give it a try. I think it is a great way to go. You'll have a good experience with it, and not just with Grace Point Healthcare and me, but direct primary care has grown rapidly across the nation. And I wish that more congressmen and senators and others would come down and take a look at it and talk to some of us about what is going on. I know, President Trump has passed some laws and stuff about transparency and pricing, and now I think your monthly payments for direct pay soon, if it's been approved or signed into law, can be used now out of HSAs to pay for your monthly plans, which many direct pay use.
Well, innovation and opening up more options are changing the game in healthcare, and you were right there on the front end of it. And so thank you for that. Thank you for your service, and stay safe.
All right. Thank you very much. It's an honor to serve.
Thank you. It's an honor to know you. Have a great one.
You too. Bye.